Healthy eating is a big part of non-invasive body contouring, and so is weight loss. And here's why. Body contouring treatments reduce fat and sculpt the body. But so many of our patients want to sculpt plus reduce fat overall. In other words, they want to lose weight too. Well, now that we have the new weight loss drugs like Semaglutide making weight loss easier than ever, the problem is new. They work so well that they lead to both significant and very rapid weight loss. You're wondering, why is that a problem? Well, it's because when the body loses so much size so quickly, the skin has trouble keeping up. We've been offering these injections as part of our Med Spa's medical weight loss program for some time now. We understand that many of you do not and will not offer these medications, but as beauty, health, and body contouring professionals, it's crucial for you to understand the mechanisms of these meds and their consequences to both skin and lean muscle mass. That way, you can be prepared to offer the best solutions to help them when they ask you for help with saggy skin and muscle volume loss. So in today's episode, we're giving you the whole story on these new weight loss injections, exactly how they impact the patient, plus the best therapies you can use to help them. So this is an episode you really don't want to miss.
You're listening to the Body Contouring Academy's Proven Profits podcast, where you'll learn simple, actionable strategies from real-world, successful body contouring professionals to help you generate more revenue, realize the profits you want, and create the life you desire. Hi, I'm Shannon.
And I'm Kay.
And we're your hosts of the Proven Profits podcast.
Hi there, healthcare professionals and business owners, body contouring and beauty professionals too, all of you. Kay here. Shannon and I both thank you for being here too. Why are we talking about prescription medication today? After all, Semaglutide and Semaglutide-like drugs, well, they're restricted to use by medical providers. Well, the thing is, whether you use Semaglutide in your practice or not, you need to educate yourself. Patients who have used it are going to be calling on you for help. Guys, and this is a brand new group of patients, a whole new market, with a need for skin tightening treatments and also treatments to help them to restore muscle. So it's absolutely crucial for you to be prepared to meet the needs of these patients. So let's dive in. What are we talking about when we're saying the new weight loss drugs? Well, as of today, there are 3 medications primarily used for weight loss, which have already actually been linked to saggy skin. You've probably heard a lot of chatter about so-called Ozempic butt, maybe, on social media platforms. But remember, each of these medications require a physician to prescribe them. Now, the 2 new weight loss drugs that are most commonly prescribed for weight loss are Ozempic, which has FDA approval to treat type 2 diabetes, so it's prescribed on an off-label basis for weight loss, and Wegovy, which is the same company's exact medication that's been approved for the treatment of being overweight or being obese. Now, Semaglutide is actually the generic name for the active ingredient that's in Ozempic and Wegovy. Now, there's a third medication that we understand is also being used for weight loss, and that's Mounjaro, which has FDA approval to treat type 2 diabetes. So that's another one that would be being used off-label for weight loss. Now, the generic name for Mounjaro is tirzepatide, and it's very similar to Semaglutide. Now, there's no available oral forms for these medications at this time. All three of these drugs are injected subcutaneously on a weekly basis in most cases. And also in most cases, the patient is the one to inject herself after receiving instruction by the medical providers. So, how do these new weight loss drugs work? Well, this class of medications started out as treatments for diabetes. They were found, though, to produce such significant weight loss as a side effect that they're now being used specifically for weight loss, too. They belong to a class of meds known as GLP-1 agonists, which mimic the actions of a gut hormone called GLP-1. Now, GLP-1 lowers the appetite because it slows the movement of food through the digestive system. It's normally released by the body after you eat, so it gives your brain, sends that message, that feeling of fullness, which, by the way, takes 10 minutes to perceive. Now, these GLP-1 agonist meds, they also stimulate insulin release from the pancreas, which will help with metabolism. You may be wondering about tirzepatide, the generic name for Mounjaro. Well, it's also a GLP-1 agonist, and it works in much the same way as semaglutide. We already touched on this, so you know that all three of these medications are prescription drugs, meaning that a physician or some other provider with prescriptive authority must provide the medication or treatment. Now, the medical weight loss program at our med spa does offer the inclusion of semaglutide injections. And no surprise, most patients do opt for these medications. In fact, the inclusion of these drugs, it's a huge driver for our weight loss program. Now, by now, nearly everyone has some kind of awareness of these meds. Our physician and nursing personnel manage the initial prescription education as well as follow-up care for our medical weight loss patients. But here's the big question, and we talked about this in the intro and at the beginning today. Do these new weight loss drugs actually cause saggy skin, like that Ozempic butt that we said? Well, the answer is yes, in some people. But in reality, any substantial weight loss, especially when it occurs as rapidly as it does with these medications, can easily lead to loose skin. Any part of the body can be affected, of course, but most of the loose skin complaints that we see are about the arms, the thighs, abdomen, and hips or buttocks. And the question that you may be thinking, but most people are not even thinking about or talking about, is do these new weight loss injections cause a loss of lean muscle as well? And the answer is yes. Experts have already found that semaglutide does lead to a decrease in muscle mass. And we're going to dive a little deeper into muscle mass loss in just a bit. Because we first need to discuss the risk factors for loose skin. Because after being stretched, the skin has the ability to return to its shape and size over time. We refer to this as skin elasticity. Now, some patients will develop loose skin with rapid weight loss, and you can predict those who are at high risk of this. Here are some of the risk factors that put patients at the higher risk. Of course, age, it's going to be number one. It's a big risk factor. As your patient gets older, everything good decreases, right? The elasticity, the elastin, the collagen, everything decreases. Also, the higher amount of weight lost increases the likelihood of loose skin complaints. That's kind of common sense too, right? Now, the patient who is also at a higher risk is the patient who has been carrying this extra weight for a long time. Sun damage or photo damage or UV damage also, as you know, decreases skin elasticity and damages skin and raises the risk of loose skin with the rapid weight loss. And also, don't forget about lifestyle. It's so important. Poor lifestyle choices regarding nutrition, sleep, hydration, and exercise, well, they weaken the skin over time too, and they put the patient at a higher risk of developing saggy skin. So, let's take a look now, a little closer look at the saggy skin and muscle breakdown combination that occurs with rapid weight loss. Because the fact is, rapid weight loss damages collagen cells and elastin cells. It's pretty well established and backed up by numerous clinical studies that the skin is damaged by rapid weight loss. The rapid loss of volume and reshaping actually causes the destruction of collagen and elastin cell networks. And here's a breakdown of how that happens. First, as you probably already know, skin is made up of two important proteins, collagen and elastin. These two proteins are what gives the skin its elasticity, its strength, and that firm appearance, the bounce back, and the beautiful tone. Well, it's the fibers in the collagen and the elastin that give the skin the ability to stretch in normal periods of growth and rapid weight gain and changes in body shape. So think about pregnancy or puberty. But when significant weight loss occurs very rapidly, the collagen and elastin simply cannot return to their pre-weight gain status, which leads to that loose, saggy, or crepey skin. And as we discussed earlier, the loose skin condition is worse in patients with those risk factors. Those conditions that led to pre-rapid weight loss damage to their collagen and elastin process, like the aging process and sun damage, etc. So now, let's look at these weight loss patients' lean muscle mass. What happens to it? There's been so much emphasis on saggy skin, but very little social media chatter about muscle mass loss. And the loss of muscle mass has so many other implications important to health and maintaining a future healthy weight. Here's a question for you. Did you know that 40% of the pounds lost from semaglutide and semaglutide-like meds is actually a loss of muscle mass and not of fat? Some studies are now showing as much as 50% of the pounds that are lost are actually lost lean muscle. This is a subject that would take an entire podcast episode to discuss, but let's just say this. Muscle is metabolism. It's what burns the majority of energy. So think about that when your patients report losing 40 pounds, think about it, 18 to 20 pounds of that weight loss is not fat loss. It's muscle loss. And no one wants to lose muscle. So let's break down how and why this extremely high rate of muscle loss happens. When the patient's body isn't getting enough energy from food, her body will pull energy from the fat reserves first. But when the patient's losing a significant amount of weight very quickly, usually about 3 to 4 pounds or more per week, but it does depend on the patient, her body will then need to pull energy from the muscles. So the more weight a patient loses in a short period of time, the more muscle mass she'll lose in addition to fat. That's why you've always heard that expert advice about losing weight slowly and steadily. That's how you know you're losing fat and not losing muscle. So you've heard that these new weight loss drugs are indeed super performers in terms of losing pounds. You can understand the huge popularity. That's the pretty side. But there's the ugly side, and that's the damage to the skin and the loss of muscle mass. Luckily, non-invasive body contouring has much to offer to help with these unfortunate side effects. So next, let's discuss what we can do as body contouring professionals to help reverse that damage. We'll discuss technologies to address both issues, skin tightening and muscle toning, and starting with loose skin. As with any body issue, some patients are bothered by their loose skin and others are not. Not all patients are distressed with the saggy skin from rapid weight loss. There are some patients that are so happy with their weight loss that the loose skin just really doesn't bother them. But for other patients, the loose skin causes major distress, thus the increased demand for skin tightening. Now, with these weight loss drug body conditions, exercise and home care, skincare remedies, they're just not going to be enough. Body contouring professionals must use treatment options to help these patients. And radiofrequency RF skin tightening, it's the gold standard technology for the treatment of loose skin. Fortunately, we have many RF machines to address loose skin. We have level 1 medical grade single technology machines that you can use if you're a physician or a med spa, like TempSure, Thermage FLX RF, or LipoCell. And we have level 3 entry-level combination technology machines for both non-medical and medical providers, like the 6-in-1 cavitation machine with RF and vacuum. It's estimated that as many as 70 to 90% of the adult population suffers from some form of skin laxity. We'll add to that the increased number of weight loss injection patients, and you have an incredible demand for skin tightening. So what exactly are radiofrequency RF treatments? Well, it's basically using heat to damage skin cells so that when these damaged skin cells repair, they return 100% healthy and not damaged. But more scientifically, radiofrequency RF technology utilizes programmed wavelengths of heat energy to produce a specific measure of heating to the skin. And when this is applied to the skin, this controlled heating prompts the body to produce new and improved collagen and elastin cells to replace the damaged cells. And basically, the basics to perform radiofrequency treatments, we recommend that you start with a series of 6 to 8 treatments scheduled weekly or possibly 2 times per week, but the treatments should never be spaced closer than 72 hours apart. Now, each treatment is going to yield subtle improvement, and each treatment builds upon the progress from the previous treatment. And here's a pro tip. When you are evaluating your patient and predicting the number of treatments that she will need, refer to the risk factors or think about them that we talked about earlier. Those same risk factors will also help you predict how well she is going to respond to treatments and how many treatments she'll likely need. So, are you already certified in radiofrequency RF skin tightening, or do you need certification? At the Body Contouring Academy, we believe that skin tightening is a treatment that every body contouring professional should offer. Skin tightening treatments are affordable, they're highly effective, they have the ability to treat loose skin located just about anywhere on the body, and they involve no downtime, discomfort, or significant side effects. So, also, you already know they're in high demand, but they're very profitable. There is minimal to no overhead required. So, we authored a course for radiofrequency RF skin tightening certification. It's in the Body Contouring 6-in-1 Masterclass, which is actually a multi-technology combination skin tightening plus fat reduction body contouring certification course. Now, the skin tightening body contouring certification course teaches RF skin tightening and gives you several bonus benefits because you'll learn skin tightening treatments plus fat reduction, cellulite smoothing, stretch mark reduction, all those treatments in just one certification course. We'll leave a link to that skin tightening course, which are like all of our courses, by the way, is 100% online with instant certification at the end in our show notes. So you can use that link to the 6-in-1 course with the skin tightening and get some more details. So that's skin tightening. Let's move on to muscle stimulation treatments so we can help patients build back that muscle mass lost during that period of rapid weight loss. Well, electromagnetic muscle stimulation, or EMS, is the affordable gold standard technology to improve muscle mass. Now, there are several other machines available, like level 1 medical grade machine, muscle toning machines, if you're a physician or med spa, that use slightly different muscle stimulation technologies like M-Sculpt, Cool Tone, and True Sculpt Flex. But level 3 entry-level machines, both medical and non-medical providers can use, and super affordable and super effective electromagnetic muscle stimulation EMS machine. So what are these EMS muscle toning treatments? Well, they involve the induction of muscle fiber contraction using electrical impulses. The contractions are stimulated by little electrode pads that you place on the patient's skin above the muscle groups that you're working. And these treatments can recruit more muscle fibers and cause so much more and substantially deeper muscle contractions than any workout could. So building back the muscle mass lost during weight loss for that patient, you can make easier. Now, how you perform these treatments is by placing the electrodes on the muscle group to induce those muscle fiber contractions with those electrical impulses. You administer these treatments weekly, and like radiofrequency, they can be done biweekly as long as the treatments are no closer than 72 hours apart. So how about EMS, electromagnetic muscle stimulation treatments? Are you certified or do you need certification? Because as you might guess, EMS is another technology that we think every body contouring provider should offer. Even before the problem caused by rapid weight loss, it's been one of the most 6 consistently popular body contouring treatments around. And that's a big reason why we authored an electromagnetic muscle or EMS body contouring certification course. So, if you want to get certified in EMS or you just want to learn more about the course, go to our show notes, check out the link, and you can get all the details. So next, we move on to a treatment that will actually address both issues, skin tightening and muscle toning. Now, we don't recommend this treatment as a sole remedy for these problems, but we wholeheartedly recommend this treatment to accelerate and enhance your skin tightening and or muscle toning treatments. Before you heard this podcast episode, we bet you didn't know there was a technology that provides support and enhancement for both RF skin tightening and EMS. It's level 3. It's called the whole body vibration therapy, so it's great for both medical and non-medical providers. But what is it? Well, whole body vibration therapy is a body contouring therapy that utilizes passive exercise to cause intense but comfortable muscle contractions, which lead to increased blood circulation, increased lymphatic circulation, and causing multiple micro muscle contractions. Now, the increased circulation provides skin cells, and the muscle provides help to the skin cells, and the muscle contractions, of course, lead to building muscle. So this is how you perform whole body vibration therapy. The patient simply stands on the vibration platform, and a typical program or treatment or session on the platform runs a short 10 minutes. You don't need to book a treatment room because you can put the vibration machine anywhere in your business, and the patient may safely do sessions as frequently as daily. Now, chances are you may not be certified in whole body vibration therapy, but we can change that. We absolutely love vibration therapy because not only does vibration therapy enhance body contouring treatments like radio frequency RF skin tightening and electromagnetic muscle stimulation, EMS, it's an incredible tool to build your business too. And we share how we use vibration therapy as a business building tour in our med spa as well as a treatment enhancer. And it's all in our vibration therapy body contouring certification course. So check it out. We left a link to the course in today's show notes. You can learn more. Now, the rise of new weight loss injections has really revolutionized the weight loss landscape. They provide effective solutions, but they also introduce challenges like the saggy skin and the muscle breakdown. And as healthcare, beauty, body contouring professionals, or business owners, it's crucial to stay ahead of the curve and be prepared to meet the increased demand for treatments from these drugs. The new weight loss drugs, including Ozempic, which is semaglutide, Wegovy, semaglutide, and Mounjaro, tirzepatide, have demonstrated remarkable weight loss results. However, the rapid pace of weight loss we've seen can cause saggy skin and muscle loss, prompting a surge in patients needing treatments for both. So to sum it up, understanding the mechanisms of these meds, the risk factors for developing saggy skin, and the impact on muscle mass loss, it's essential for providing comprehensive care. Rapid weight loss can damage collagen and elastin cells. This leads to loose, saggy skin, and add to that, a significant portion of the weight loss, 40% or more, may result from muscle mass loss. So we've highlighted the two key technologies to address both the loose skin and the muscles: radio frequency RF skin tightening and electromagnetic muscle stimulation, or EMS. These non-invasive treatments offer a range of benefits, including affordability, effectiveness, and the ability to target each of the concerned body areas. Our skin tightening certification course, the 6-in-1 Masterclass, covers RF technology comprehensively, providing you with the expertise to perform these treatments in addition to fat reduction, cellulite smoothing, and stretch mark treatments. And the EMS course equips you with all the tools that you need to help patients rebuild muscle mass from that rapid period of weight loss. And if you want to enhance both treatments plus have a great business building tour, the whole body vibration therapy course is amazing. So it's exciting when brand new body contouring options are released. We get super excited, and we really enjoyed sharing the basics about the new semaglutide-like weight loss drugs with you and helping you prepare to meet the needs of these patients. But that's it for today. Until next time, beautiful wishes.
If you enjoyed our podcast, we'd really appreciate it if you take a few minutes to leave us a review. And if you'd like to learn more about our courses and resources, you can get all the scoop by visiting our website, bodycontouringacademy.com. That's bodycontouringacademy.com. Thank you so much for listening. As always, have a great rest of your day. And until next time, beautiful wishes.